Now, you know what I'm starting to realize? I don't care where you go or what you do. The grass is just never greener on the other side. I don't care what state you working in, what city you working in, or even what facility you working at. It's always gonna be some shit everywhere you go. And the sooner you realize that, the better off you'll be. What's going on, family? Welcome back to the channel. My name is Tyron Tyson, best known on the streets as The Urban Nurse, and you are now tapped into the #1 channel for healthcare hustlers and entrepreneurs like myself. Now listen, take some advice from somebody who knows. I've worked in my fair share of facilities. I feel like I've worked at every hospital in the city that I work in. And I've been to other different states and worked in other different cities and worked at other different facilities. Now I'm one of those, peeking over the fence trying to see if the grass is really greener on the other side. Once I have a problem at one facility or once something pops up that I just don't like or just doesn't sit with me, look, I'm ready to go. I'm ready to get out and I'm ready to go on to the next spot. Which is why, I appreciate agency and travel nursing so much, because I'm not confined or I'm not obligated to work at one facility for however long. I got a 3-month contract or a 8-week contract and then I'm out. Because I'm honestly starting to realize that everywhere you go, it's gonna be a problem, because when the system is broken, so is everything else within it. So, when I first got into nursing, was actually looking for a place to work, looking for jobs. I got caught into the big names, and I was always one of those, I want to work at, a level 1 facility. I want to work at a magnet facility. I want to work at one of these big name hospitals, because me going there and me thinking that because it's new, it's nationally known, and all the best of the best go there, I would think that it would be the best of the best facility. And being as though, I've traveled around and I've worked at different hospitals, I'm starting to realize that everywhere you go, somewhere is lacking. There's a problem somewhere, everywhere you go. And I say this because my last contract was just at a level 1 trauma facility. Never worked at a level 1 trauma facility ever before in my life. And that was always really my goal, especially when I was like a new grad or I was getting out of school. I wanted that TV experience of what I saw either from Grey's Anatomy. And let me just let you know, I've never watched Grey's Anatomy in my life. One of those big facilities, which I thought was, probably the best place for me, because I'll get to experience everything. I'll get to see everything. It'll be fast paced. They'll have all the new technology and different things like that. But I started off, I climbed my way up from the bottom. I worked at several different teaching facilities. I worked at facilities that were magnet. I worked at facilities that were trying to achieve magnet status. And every time I go to one of these facilities, I'm starting to realize there are a lot of holes in the system. There are a lot of places where this will be a nice facility, or this is just some trash, so and I feel like every hospital that you go to is going to be missing something. There's going to be one facility that had something that you like versus another facility that had something that you like, but this facility didn't have what that facility had, or this facility didn't have this thing that facility had. So I just realized that it's always going to be something everywhere you go that either you'll like or you don't like, something that makes work easier or something that makes work harder. So for example, one when I was working in Arizona, which was a small local community hospital, just like my last contract. But this one, I didn't have a tube system, so I had to walk all my labs down. I didn't have any physicians on the unit at nighttime. I pretty much had to call out to the main campus in order to get an order placed in by a physician who's never even seen this patient. There were a lot of things as far as just the supervising staff, as far as like scheduling, there were a lot of issues because it was all left on one person. So then me leaving that hospital and then getting a new contract, and I'm like, okay, I was working at a prestigious, well-known facility institution in Washington, D.C. And I was really excited because I'm like, it's a level 1 trauma facility. They're going to have all the best doctors. They're going to have all the best resources because they're dealing with high acuity patients. High level foreign governors or legislators come there when they're coming to DC, and if anything happens, I thought it was kind of a big deal. But when I got there, I just realized that it was poorly managed. It lacked a lot of resources, or the resources were never sufficient enough to help you do your job appropriately. And then it was just very disorganized. So disorganized from the sense of there was no continuity in, let me just say, the utilities that you used. You could never figure out where anything was at. Nothing was never in the same place. I don't care which floor you went to. Supplies were in different closets, in different areas. You would expect me working in the ICU, going from the neuro ICU to the cardiac ICU or the surgical ICU, all the supplies would be in the same place, or they would have all the supplies on each floor. But it being what it was, I had to go from the 3rd floor to the 5th floor to look for something that was actually on the 2nd floor. And it just kind of got in the way and inhibited me from being the best nurse I could be. Another issue that I saw was the resources like the lab or the pharmacy were very, very slow. It took me forever after med requesting a medication to get it sent up from the pharmacy or to get it bought up. And I'm dealing with high acuity patients who got drips that's going on. If their drip run out, then they could potentially die. So I'm having to call down several times, stopping the care that I'm giving to follow up on a medication that I requested hours ago. Or if I send my labs down to the lab, my biggest pet peeve is they keep hemolyzing my labs. They were losing my labs. So I would send down a lab and it wouldn't get resulted for 3 hours. And that's after me having to call down there or walk down there and say, hey, I placed this lab right here because I had to walk it down because the tube system was down. The tube system is always down. I personally placed it right here and I even got your attention. And then something always happens. Something is always wrong. And that gets put on me because the physicians are coming to me looking for lab results, wondering what's going on because this is supposed to be a serial test. You know what I'm saying? Y'all making me look bad. Y'all getting in the way of my work, and now it's getting looked at on me as if I'm not doing what I'm supposed to do. When actually, it's the resources around me that aren't helping, that are lacking. Another big problem that I see is, just like within nursing, there's never any help. There's never any help. I'm starting to get so used to just doing everything myself and feeling overwhelmed and, getting to a point of drowning because there's never any help on the unit, and especially on night shift, we don't get the luxuries that day shift gets, resource nurses that come around and give you your break and things of that nature. No, we don't get that. And I'm starting to realize that everywhere I go, they don't ever have enough techs, and me being a former tech myself, I appreciate my CNAs, my PCTs. I appreciate y'all so much. But it seems like everywhere I go, there never are none, especially on night shift. We'll have, at my last facility, we had 1 tech covering 2 ICUs. Now you tell me how that works out. I'm gonna give you a second. Yeah, we had 1 tech covering 2 floors and they running back and forth, and I understand. So I'm not gonna ask you for help and overwhelm you because you got 10 other nurses that's pulling and trying to get you to do things. And I know if I waited around on you, then I'm never gonna get anything done. So I realized that it was never any help because people were so tired, so spread thin, or people just not coming to work at that facility, or people just not coming into work at all. So I realized that majority of the issues either fell into the lack of supplies, the lack of help from resources, and the lack of just manpower. I can't see what's going on with the big wigs. And a lot of the problems that I faced on my last contract were it was poorly staffed. So that then gets into the point of, okay, who's making the schedule? Somebody is making the schedule. They're giving people off in this area. They're putting people on in this area. There's some days where we're overstaffed, and then there's some days where it's not even understaffed. At this point, it's just a skeleton crew. So it's like, who's making the schedule? And then even with the people who are making the schedule, it then becomes, okay, who does this person like versus who this person doesn't like? It becomes very political as far as, okay, who's getting this patient, who's getting the worst patient. And I know being a travel nurse, I expect it. I'm going to get the worst assignment, and it just is what it is. But there is no reason that all of your travelers are tripled and your staff nurses have 1 patient. And I'm not the one to talk about fairness, but it just don't add up. So I'm starting to realize, and I want you guys to realize, especially, my new grad nurses who are just getting out of school and trying to make a decision on either where to apply to or which job to accept. Don't get caught up in the name. Don't get caught up in the facility. Don't get caught up in what level or what kind of facility that you're working at, because understand, when you get in there, you in there. So you kind of gotta, get with the program and make the best out of it that you can. Because like I said, it's gonna be some shit everywhere you go. So you better take them lemons and make lemonade. So if you enjoyed this video, please like, comment, subscribe. Like I always say, tell a friend, especially if they're a nurse. And I see y'all when I see you.